So what is the Emerald Programme? This is a project over 5 years funded by the European Commission to achieve mental health strengthening in low and middle income countries. Specifically, there are 6 countries involved: Ethiopia, India, Nepal, Nigeria, South Africa and Uganda. And together with colleagues from the World Health Organization for Centres in Europe, we're working together to find ways to make a clearer case to governments the investment in mental health, establish ways to measure progress, and to offer skill upgrading for service providers, for policymakers, for researchers, and for patients and service users and caregivers. So the programme as a whole is an integrated approach to strengthening systems for better mental health care and for more mental health care in low and middle income countries.
So we have a gross shortage of human resources and financial resources for mental health care in low and middle income countries. Most African countries spend less than 1% of their health budget on mental health. And there's one psychiatrist for every 2 million people in Africa, one psychologist for every 2.5 million people. We simply don't have the specialist skills and human resources to deliver mental health care to meet the needs of our populations. And so we really need to look carefully at the systems that need to be in place in order to deliver care through primary health care, because it's really only through primary health care, through integrating mental health into the general health system, that we'll be able to meet the mental health needs of populations.
The problem is not knowing how to get that done, the how rather than the what. So these are really problems of implementation. You know what to do, but how to actually get those implemented on the ground in an effective, sustainable, feasible way. And these actually become health system problems. This Emerald project is taking a very health systems approach, which is fairly innovative in this area, and is coming from that starting point. And as a result, it means that we are trying to address some issues that have been arguably not very well addressed in the past by researchers or innovators.
One very important area that this project covers is that integration of mental health into other health service delivery system. In most African countries, mental health is left to one big hospital that is situated in the capital city, which is very old, low standard in care provision. But now this project envisions that care will be decentralized and also integrated with other healthcare systems in equitable and fair manner. And also it invites the involvement of service users in planning, policy making, monitoring and evaluation of the care that is being provided by care providers and also the family.
With this project, we're going to identify a situation, we're going to provide evidence. We also want to make it possible for the information that we gather, that the results that we gather, the evidence that we gather, to have some impact beyond the scientific community. We want to reach a much bigger audience, not only in terms of the scientific audience, but also policymakers, planners, users, first of all, who know about the findings we are, particularly the ones that are working, that are living in the areas where the 6 countries where this study is going to be carried out.
So what is the scale of the challenge posed to all of our countries? by mental illness. It's actually enormous. We know, for example, that in all of our countries, at least 20% of adults this year will have a mental health problem severe enough to need treatment. We know across the world there is one suicide every 30 seconds. We know that of all the burden, the impact of all health conditions across the world, fully 8% come from mental illnesses. So there is a very considerable challenge, and indeed a growing one, as our societies become richer and as communicable and infectious diseases play a smaller part, a growing challenge of mental illnesses which are one type of non-communicable or chronic diseases. So that's the challenge. What's the positive aspect? It's that increasingly now we have strong evidence in low and in middle income countries that we have effective treatments, we have affordable treatments, that many people who have these conditions will recover, often within weeks or months, and then go back to live productive and active contributory lives in normal society. So we have the technology to do that. What we're working on now, and which is gradually coming, is the understanding among governments about the impact of mental illnesses and support for mental illness within the whole realm of non-communicable and chronic diseases as a public health priority across the world.